As part of her state budget address, Governor Kathy Hochul says New York plans to invest billions of dollars to expand access to mental health care. Locally, those expansion efforts are well underway at Golisano Children's Hospital. Natalie Kutchko spoke with hospital leaders to get an update on the projects there. Natalie.
Teresa, right now work continues to build out both the pediatric and adult psychiatric departments, starting with a new facility for children and teens to go in the event of a mental health emergency. Construction has begun for a new pediatric mental health urgent care at Golisano Children's Hospital, the first of its kind for our region and only the second in New York State. Lauren O'Pladen is an ICU nurse at Strong. She's also a major advocate behind the project. After facing severe depression in 2017, O'Pladen was admitted to Strong's inpatient unit. It's the care from staff there, she says, that ultimately saved her life and inspired her to pursue a career in nursing.
It brings me so much joy to see that attention is finally brought to the topic and that change is happening right in front of our eyes. It's not, oh, well, change is coming, because that was something that was told for a long time. But change is now. Change is finally happening, and that's needed.
Officials say the urgent care will help to accommodate children and teens experiencing a mental health crisis, streamlining those services at a time when demand persists.
Today, this week, we'll receive about 100 requests for new mental health services in our facilities, and that's been the number we get every week now for about a year. For folks who just need connection with services of any intensity or urgency. So we'll be able to schedule appointments, we'll be able to do walk-ins 7 days a week, and we'll be able to do routine as well as crisis or emergency visits there.
With firsthand experience, O'Pladen says this will be critical for the future generations dealing with similar struggles.
This is going to be a huge change in not only Rochester, but all of our area around us. I really thank everyone who's been willing to put the stigma aside and focus on what's needed for this next generation of upcoming kids, and something to help hopefully make their future better, and hopefully they're not going to be in the position I once was.
And work on that urgent care is expected to be completed before the summer, sometime in June, we're told. Strong is also in the midst of expanding its psychiatric emergency department 4 times its size. Completion for that is a few years out for 2027. In the studio, Natalie Kutchko, News 8.